Hey everybody, Dr. Amar here, wanting to review with you how to perform these post-frenectomy stretches. So let's take a look. Let's start with why we do these stretches. Anytime we undergo some kind of injury or trauma, the body has a natural desire to try and repair things to where they were prior to that injury. So in the case of a frenectomy, if there's problematic tissue that's preventing a lip or tongue from functioning properly and we remove that tissue, the body's going to try and reattach those tissues back to where it was prior to the frenectomy. By performing these stretches, you are essentially removing the cells that are rushing to that area, trying to reattach those tissues back together. The goal is to try and influence where those healing cells put things back together, resulting in the lip and or tongue moving independently and with full mobility. Because the majority of healing takes place over the first couple of days and weeks, we place a strong emphasis on stretching very frequently for those first few days and weeks after the treatment. We have found that by pairing the stretching with the feeding, not only are we able to stretch the site frequently enough for good results, but we also see that the child will be able to calm down quickly on the breast or bottle. When getting ready to perform these stretches, I want you to be positioned behind your child with their head closer to you. Using your index fingers, you're going to use gentle but firm pressure, and you really only need to be there for a few seconds, about 5 to 10 seconds per stretch. In terms of frequency, as a general rule of thumb, we do recommend pairing the stretches with the feeds, but of course, every child is different, so I will review with you what we recommend for you and your child. Generally speaking, we don't want you to go longer than 4 to 6 continuous hours without a stretch, especially those first 2 weeks. These numbers, remember, are just here for standard recommendations. If you use these and they work for you, great, but we will customize these based on your child and feeding schedule. By 4 weeks after the procedure, that white healing tissue should have resolved back to normal pink tissue, which signals to you that you no longer need to perform the stretches. A common question I get is, am I supposed to wake my child up to stretch? While I don't need you to wake them up with the sole purpose of stretching, if you are waking them in order to feed, or if they wake up to feed, then yes, please perform the stretch at that time. The majority of healing does take place overnight, so make sure that first stretch is a very thorough one and really separate those tissues. When doing the lip stretch, I want you to start with your fingers at the corners of the mouth and move them forward towards the side of the frenectomy. You need to be able to see that full diamond in order to know that you're getting that full stretch. If you can't see the full diamond or you slip off, no big deal, just reset and re-stretch. You can also rub your finger on that site so you can clear away those cells. I like to tell parents to pretend like they're trying to stretch the lip over the nose. So try and get that lip as high as you can so we can get some great healing and great results. For the tongue, try to get that middle finger of your dominant hand to rest on the chin. This will allow your child's mouth to open. You want to get your index fingers underneath the tongue and as close to the apex of that diamond as possible. Once your fingers are in the right position, place some firm but gentle pressure to elevate the tongue up to the roof of the mouth. Again, you need to be able to see the full diamond in order to know that you're getting a full stretch. The tongue and lip will heal to only as high as you will stretch those tissues. So if you want to get the maximum benefit of the treatment, you absolutely must elevate the tongue or lip to as high as they are immediately after the procedure. You don't need to be in there for minutes at a time, just 10 to 15 seconds of a thorough stretch, and then put the child on the breast or the bottle, and they will calm down rather quickly. When placing your fingers underneath the tongue, please make sure to go deep towards the base of the tongue. The deeper the fingers are placed underneath the tongue, the less likely the tongue is to slip away when doing the stretches. Once we have our fingers sufficiently positioned, bring them together towards the midline and then elevate the tongue up to the roof of the mouth. You can think of it as in 3 steps: deep, together, and up. A final point about finger placement is to try and place your fingers at the apex or the top of the diamond. When the diamond is fully stretched, it'll go from looking short and wide to tall and thin. You'll be receiving a text message from me with a link to this video, so you should be able to reflect back anytime you'd like. I look forward to seeing you in about a week to see how things are improving. And remember, if you have any questions, I am always here for you. I'm just a text message away. After having done thousands of these frenectomies, there's basically nothing I have not encountered, so please don't feel shy to reach out. I'm wishing you guys the best, lots of luck. Thank you for your trust, and I look forward to seeing you guys soon. Thank you.